Hello there, welcome to another episode of Putting Dr. G on the spot in the month of April when we're discussing various forms of infection. And on this occasion, we're talking about one form of sexually transmitted infection that is called gonorrhea and chlamydia. Gonorrhea and chlamydia are actually classified as venereal disease. And then basically these are transmitted by sexual contacts, and that includes penetrative sex and also oral sex. Why is this such a problem? This is such a problem is because it actually stays dormant in many people. For example, in the USA, it is actually estimated that about 4.2% of general female population will harbor chlamydia without knowing about it. And only about 2.7% of men will harbor chlamydia without knowing about it. When during sexual contact, the bacteria is transmitted from one person to another, and that might result in significant inflammations. And that inflammation in women is called pelvic inflammatory disease, and then in men that will cause urethritis, which is a discharge that is constant. Men will not actually tolerate dormant infections as well as women, because women don't know about it, but men will constantly have burning sensation that actually will seek help from doctors. And as far as gonorrhea is concerned, that is dormant in about less than 1% of both men and women, about 0.8% in women and 0.6% in men, and then that will constantly have a discharge coming out from the urethra. And both of these bacteria are not really able to be cultured. In the old days, we will use a swab and then do something called a gram staining. And gram staining will tell you that these bacteria exist and antibiotics is given. But in modern days, we use a PCR to determine the existence of the bacteria and subsequently treat the person who is infected and also do contact tracing so that the infections will not go forward and backward, resulting in multiple treatments. The treatment itself is a very specific type of antibiotics that include ceftriaxone and also other types of antibiotics such as doxycycline. And with these bacteria, the elimination rate is only good if the whole course of antibiotics is completed. However, one needs to be careful. If the whole course of antibiotics is not completed, then they may risk these bacteria building resistance, just like penicillin. In the old days is actually very effective, but these days is no longer effective. Another form of infection that we're going to discuss next week is an infection of the testicles. Why can the testicle get infected? If you want to find out more about it, obviously you need to stay tuned for next week's Putting Dr. G on the Spot.